Right. This was a phase 2 study of the American Society of Hematology that evaluated the role of convalescent plasma in patients with COVID-19. We present in this meeting the results of the donors. So we had two parts in this study. One part was the evaluation of the donors for the plasma, and one part was the patients who received the plasma. So the second part has not been finished yet because we aim to treat 100 patients. We are very near to the end of the recruitment. But regarding the donors, we evaluated 259 previous patients with COVID-19 who wanted to voluntarily give their plasma for the new patients. So from these 259 patients, we checked different we checked their antibodies with different methodologies. We used one commercially available, the Euroimmune from Germany, which evaluates the antibodies targeting the S1, the spike 1 protein domain of the virus. But also we had two more evaluations. The one was with a multiplex ELISA, which used the Luminex platform, evaluated antibodies against the S1, but also the nucleocapsid, the N protein of the virus, and also the RBD, which is the main domain of the receptor of the virus, the receptor binding domain, which seems to be the most important. And also we have evaluated neutralizing antibodies that are not described in the abstract because we have not had the results yet. So what we've seen is that with all the methods that we used, patients who were asymptomatic, and we talked about donors, the inclusion criteria had the PCR positivity, even if they had symptoms or if they have not had symptoms. So the PCR positivity was totally obligatory in order to participate in the study, offering their plasma. These 259 patients had been diagnosed with COVID-19, so the PCR positivity on the first day of their symptoms was a median of 62 days before the blood sampling for the checking for the antibodies. So we've seen that within these 2 months of symptoms or PCR positivity, because if they were asymptomatic, we measured the first day as of the disease as the first day of the PCR positivity. We've seen that almost 88% of the patients had antibodies against the SARS-CoV-2 virus. And 74 of these 88% of the donors have been already given their plasma, and this has been analyzed. We measured also the antibodies with all these methods that I described, not only at the screening, but also at the day of plasmapheresis. So regarding these 74 patients that we measured the antibodies on the day of plasmapheresis, we've seen a dramatic reduction of the antibodies from the day of screening to the day of plasmapheresis. The median time was 12 days, and the median reduction was 12%. So we've seen that within 12 days, we had a 12% reduction of these antibodies. And this reduction was more obvious in those patients who were screened, who had their blood testing after 60 days after the first day of the symptom or the first day of PCR positivity if they were asymptomatic. We've seen also that the antibodies of the asymptomatic patients were much lower compared to the symptomatic patients who did not need hospitalization, and these antibodies were lower, the titers, compared to those patients who had symptoms and were hospitalized. Also, we've seen that the presence of symptoms correlated with fever, anosmia, and loss of taste in a multivariate model. And also, we've seen that patients above the age of 50, probably because because of their hospitalization status, had more antibodies, while patients who were tested within 60 days of the first day of the symptom or the PCR positivity had also higher titers of antibodies compared to all others. And this is also found to be important in the multivariate model. So I think in general we can say that we observed a reduction in the antibody titers against the SARS-CoV-2 even after 12 days at the median in patients who gave their plasma. And this happened at a median time of around 70 to 80 days post the first day of their symptoms of the PCR positivity if they were asymptomatic. We don't know if this has any impact on their immunity, because as we know, the immunity has also other factors. We have the cellular immunity also, we have the B-cell memory cells. So we don't know if this reduction of the antibodies plays any important role in the immunity of the patients. But what we know is that if we want to take the convalescent plasma, the best way to do it is to do it as early as possible after the disappearance of the symptoms of the patients, or after their after having no symptoms and after their release from the hospital.